Imagine a superbug that doesn't just resist treatment but hides in hospitals, clings to your skin, and silently kills up to 6 out of 10 people it infects. It's not a virus. It's not a bacteria. It's a fungus and it's real. Meet Candida auris, a deadly drug-resistant yeast that's spreading across hospitals in the US and around the world. Why is it rising so fast? Why are doctors worried? And could it threaten you or your loved ones? In the next few minutes, we'll uncover the terrifying truth about this invisible killer. What's being done to stop it? Section 1. What is Candida auris? Candida auris, often abbreviated as C. auris, is a type of yeast. First discovered in 2009 in Japan. Unlike typical fungal infections, C. auris is extremely resistant to common antifungal medications. It belongs to the Candida family, which includes other yeasts like Candida albicans, common cause of thrush or vaginal yeast infections. But C. auris is far more dangerous. What makes it different? It's multi-drug resistant. Most strains are resistant to at least one of the 3 main classes of antifungal drugs. It's hard to identify. Traditional lab tests often misidentify it, which delays treatment. And it spreads easily in healthcare settings like hospitals and nursing homes. Section 2. Why it's so dangerous. C. auris is not just another fungal infection. It's what the CDC calls an urgent public health threat. Here's why. 1. High mortality. Between 30% to 60% of infected people die. Many already have weakened immune systems, but even healthy people are at risk. 2. Outbreak potential. It can linger on surfaces for weeks and survive standard disinfectants, making hospitals ideal environments for rapid spread. 3. Silent transmission. Some patients carry the fungus without symptoms, unknowingly spreading it to others. 4. Resistance. In some cases, doctors have run out of effective antifungal drugs altogether. Section 3. Global and U.S. situation. Since it was first discovered, C. auris has spread to over 40 countries. In the U.S., cases have surged dramatically in the last few years. As of 2025, over 10,000 clinical cases have been reported in the U.S. States like New York, Illinois, Texas, and California are hot zones. In New York alone, nearly 1,800 cases have been confirmed. And infections are rising not only in patients, but also in asymptomatic carriers. What's even more alarming? Some strains in the U.S. are resistant to all 3 classes of antifungal drugs. Section 4. Where and how it spreads. C. auris thrives in healthcare settings, especially intensive care units (ICUs), long-term care facilities, nursing homes. It spreads through contaminated surfaces like bed rails, doorknobs, and medical equipment. Direct contact with infected patients or healthcare workers' hands. Shared medical devices like thermometers or catheters. Hospitals have had to shut down entire units to stop outbreaks. Section 5. Diagnosis and challenges. Diagnosing C. auris isn't easy. Standard lab tests often confuse it with other types of yeast. Specialized molecular tests, or MALDI-TOF technology, are required for proper identification. Delays in accurate diagnosis lead to delays in treatment, worsening patient outcomes. Healthcare workers must act fast, and so must labs. Section 6. Treatment options. Treating C. auris is complicated. Echinocandins, such as caspofungin or mycofungin, are the first line of defense. But some strains are resistant even to these drugs. When that happens, doctors may use high doses or combine drugs, despite potential side effects. This situation has fueled urgent research into new antifungal agents. One promising new drug is ibrexafungerp, marketed as Brexafem, which shows activity against resistant strains. But we're racing against time. Section 7. Prevention and control. Preventing C. auris outbreaks requires strict infection control. Hand hygiene is crucial for healthcare workers. Environmental cleaning with EPA-approved disinfectants is mandatory. Screening and isolating infected or colonized patients helps stop transmission. Public health tracking and early detection are essential. Hospitals must implement protocols similar to those used for COVID-19 but specific to fungi. Section 8. What you can do. Even if you're not in a hospital, there are ways to stay informed and safe. Stay updated with CDC alerts or your local health department. Ask about infection. Control policies when visiting loved ones in hospitals or long-term care. If your family member has a weakened immune system, be extra cautious with hospital exposure. Candida auris is a deadly fungus spreading quietly, but rapidly, especially in healthcare settings. Its drug resistance, ability to linger on surfaces, and high mortality make it a top-tier threat. But awareness, early detection, and rigorous infection control can save lives. Thanks for watching. If you found this video helpful, give it a like and share it with someone who might need this information. And don't forget to subscribe for more critical health updates.